Okay? Does that kind of make sense? So again, look at any muscle, and if you'll look at where the joint, between the joints, follow that line and work perpendicular to that. Okay? Remember the geometric, or from geometry, perpendicular is that sign. Okay? Or actually this way, right? From geometry. So we're going to work perpendicularly to the way the direction the muscles run. So if we're looking at this muscle, we wouldn't work it this way, we'd be working it cross this way, okay, in a cross friction. The same thing then with a scar. You want to work that scar in a cross friction pattern to help to loosen it. Remember when you had that scar, maybe you've had some type of a knee injury, maybe you've had a surgery, maybe you've had some type of a trauma again that's left a good sized scar. As that starts to heal, cross friction that response so that the connective tissues can start to model in a correct position or pattern rather than just being in a modeled or a chaotic lane. Okay? Because then a fiber that's lined up with itself in the normal movement will allow then for optimal healing and lymphatic drainage and still then push off or strengthen the muscle. So we want to correct that and activate that in a cross-friction pattern. Okay? So how does that apply then to somebody who's had a knee injury or has had knee replacement? Again, find where that knee comes down. In essence, what you're going to be looking for is where the surgical scar comes across. So we're getting too many volunteers up here. Let me just take these guys off, okay? I'll come back to these. So let's just give another example. We have this individual who's had knee surgery, and in their case, what we're looking for is how can we correct this scar. And what we'll see very commonly is where the scar is, again, there will be some type of adhesion here. So what you'll want to do is work across in a cross-friction pattern that scar. Once the staples have been removed or once the stitches have been removed, we know we're not going to pull that apart. We want to actually work that in a cross-friction pattern. Now here's the other key. As it continues to heal, this scar will have, just like any other connective tissue, it has the movement that goes both left and right. It has an upward and a downward movement. It has an outward movement to it. Okay? So we have in essence an X, Y, and a Z coordinate, but then it also has a movement of torque or rotation. So we also want to look at this torque or rotation to this scar. And what's really fascinating about scars, I think is fascinating, is that they will actually create in the brain a pattern of weakness that will continue to create a signal of don't move if we move in a certain direction, or it will fire in a certain direction. So Jen has the most recent scar. Can we show an example of this? So Jen's had a knee that's been recently, was it scoped or what did they do more?
Meniscus, lateral release, and chondromalacia.
Chondromalacia patella.
They drilled into the femur.
Okay. So we've got then the typical arthroscopic scars that are associated with the trauma of post-surgical healing. I'm going to borrow this chair so we don't have you bouncing too high. Let's let you sit on this one, okay? And then what we'll do is set this one out so people can see. Okay? Comfortable there? Okay. So can everybody kind of see that? If you want, you're welcome to stand and get a better look at it. What I just want to show here briefly is how these tiny scars, okay, even though they look very small, remember the scope is a really fascinating metal instrument that's about this size that once they make the incision is actually inserted into that incision, right? So that's how they're going to be doing that procedure. So when you think about this, it's just like injecting, or a large injection. Here's that scope, and it's actually being inserted into that knee. All right? So that scar isn't just a 3/8 of an inch or a 1/4 inch. It's actually the length, potentially, of the scope's penetration into that joint. All right? So as we look at this, the scoping procedure, which I think is really phenomenal, is there's irrigation comes in, so there's fluid in, fluid out, and then the scope actually goes in and does the procedure from the side. You've seen those little videos where you can see the fibers and the cartilage actually floating in the water. Okay? So what we find, though, is in an applied kinesiology technique, and then from a neurology standpoint, if we do a muscle test, is your shoulder okay? You could resist. So we could actually just use the anterior deltoid muscle, and when we put a little stress on this scar, hold strong, you'll see that there's a weakness, and then what we do is, her eyes, if we move her eyes in a specific pattern, we can actually do a scar release. So with your eyes only, look upward, so straight upward and resist for us again. Good, look straight ahead again. So when she's looking straight ahead, eyes straight up again, we'll see that there's a position where it strengthens. Do you see that? Relax there. So we keep that pressure in that direction on the scar, and then we'll actually, follow my finger, we'll actually have her pursue 4 times that, just my finger, to actually release that. So that will actually release the scar. So we'll go through all those patterns, X, Y, up, down, then we go diagonal, diagonal, which is kind of a Z factor in essence. We can lift it upward and then spread it, and then we'll torque it. Okay, so eyes upward again. Okay, eyes downward. So in this case, it's going to be eyes down. Relax that arm. Follow my finger here. So we'll go down and up, back to center. 2, 3, 4. Hold again, and then we'll torque it the opposite direction. Okay, and she doesn't have any weakness in that now. Now here's the interesting thing. If we actually look for a range of motion pre and post, sometimes just by doing a scar release, I should have shown how much motion you had and what the comfort was. But if we actually treat that correctly, we can actually restore the range of motion just by doing a scar release. Okay? So we have 1, 2, we only have 3? And give you a 4, so he irrigated from this side. So let's just go through all these scars. Okay? So go here, 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 here. Hold that one again. There's the weakness. Eyes upward. Good. Relax. So we'll pursue again. 1, 2, 3, and 4. There. Good. Come to this one. Good. Is that too tender? Good. Good. Just below that.